To take you through a brief tour of your heart, if you imagine we'll remove or open your breastbone, this is what the surgeon sees after the breastbone has been opened. This is your right atrium, right ventricle, left atrium, and left ventricle from the outside. You can see the arteries on your heart. These are your coronary arteries. If you were to need a bypass graft, we would take one of the mammary arteries off of your chest wall and bypass it down here for a blockage up in here, say, so that the blood can make its way through past the blockage over to your coronary artery. We also will frequently operate on the valves of your heart. If we look on the right side of your heart, we find your tricuspid valve. That will occasionally be involved in patients who have mitral valve disease. That valve can usually be repaired, and we might make your tricuspid valve a little bit tighter and repair that. More commonly, we'll operate on your mitral valve. This is the valve that separates the power chamber of the heart, the left ventricle, from the left atrium. As the blood with oxygen comes back from your lungs into the left atrium, it moves through this mitral valve and into the left ventricle. The mitral valve then has to close when the heart squeezes, when the ventricle squeezes, getting blood out your aorta, or the blood backs up into the lungs. Patients with leaky or regurgitant mitral valves have a dysfunctional mitral valve, and when that doesn't happen, when that valve doesn't adequately close, they'll get fluid and blood back in their lungs, which will decrease their ability to exercise and render them short of breath with exertion. We also can see in this model the ascending aorta, the branches and blood vessels to the brain, the aortic arch and descending aorta, all components of the heart that the surgeons at Dartmouth-Hitchcock are highly capable and experienced in operating on.